Did you know that you will lose a lot of bone in your mouth when you get dentures? And this can affect the way that your face looks. That's the bad news. Here's the good news. Okay, so I make dentures, and this is one of the setups that I just did today. And you know, when the bone shrinks after having dentures for a long time, this bone up here is going to shrink up and back. And so you're going to lose some of this fullness in your lip. You know, the lower is going to sink down and back as well. So a lot of denture wearers, they complain about having facial structure collapse in this area. We're getting to the good news, okay? So I have a lot of patients that are older and they have been wearing dentures for many decades and they do have a lot of bone loss. So this is what I do. When they have a lot of bone loss, when I'm waxing this up and molding this denture, setting these teeth, I will thicken this area up in here, you know, right up in here, to give them extra support. And this can be made pretty darn thick. Now, it can't be made very tall because, you know, it gets up too high right here, it'll be sensitive. But I can really thicken up this area and kind of give a little bit of a facelift right there. The other thing that you want to keep in mind is that, you know, when you have that change in your gums, when it has, you know, shrunk up and back and, you know, on the bottom, down and back, you know, if you continue to wear the same dentures and don't ever have them relined, then that's just your teeth are getting worn down on the surfaces and the gum is shrinking. So the denture is moving up into that space on the upper and the lower is moving down, you know, following the shrinkage of the gums. So, you know, one of the most important things to keep that facial structure is to get relines as needed. When the denture gets loose, you need to get a reline. And every 5 to 7 years, you need to get new dentures. You know, it's not that dentures won't last for more than 5 to 7 years. They'll last a long, long time, but you should not be wearing them for more than 5 to 7 years because of that change of your bone structure. You know, with this shrinking up and back, this shrinking down and back, you know, that's changing the way that your jaw is coming together. The more closed that bite gets, the harder that your jaw is having to work to chew your food. So a lot of times with patients who wear dentures for 10, 20, 30 years, and they come in and I see this muscle right here, this is very stretched out, resulting in their jaw kind of stretching out and moving forward into kind of this underbite position. It's called an acquired protrusive position. So I can't stress to you how important it is to make sure that you are getting those relines when your denture is getting loose and getting them replaced every 5 to 7 years so that you are restoring that proper dimension. It's called the vertical dimension. You want to restore that so that your jaw is, you know, in the right relationship with your bite and that your teeth are not, you know, sinking way back in your mouth. Okay, I hope that helps. You guys have a great day.